This video provides techniques for the management of a small pupil during phacoemulsification without the need for iris hooks or a dilating ring. Modern operating microscopes have red reflex enhancing technologies, including stereocoaxial illumination. Using the red reflex enhancer alone, in this case the Lumero 700 from Zeiss, is very useful in small pupil cases. Note how the red reflex improves when switching from regular lighting to the red reflex enhancer alone. Use of epinephrine. Epinephrine helps in maintaining mydriasis, particularly in floppy iris cases. Should the pupil become smaller, repeated intracameral epinephrine can be administered with the resulting benefit. Viscodilation. OVDs help with the initial enlarging before Kapsulorhexis. However, repeated injections are necessary to maintain mydriasis during the surgical steps. Blind Kapsulorhexis. With a little bit of training, the curvilinear Kapsulorhexis can be done blind. This means that the edge of the Kapsulorhexis will be behind the iris. This maneuver appears more difficult and challenging than it is in practice. The surgeon starts Kapsulorhexis at the pupil margin, then lets the rhexis margin disappear under the iris while maintaining the angle of movement. Upward opening of the irrigation aspiration system. Using a bimanual irrigation aspiration system with the aspiration port having its opening pointing anteriorly is of great help when removing cortex in small pupils. Note how easily you can remove cortex using a bimanual system having its opening pointing anteriorly. Direct in the bag implantation through a small pupil. The surgeon can avoid pupil manipulation during IOL implantation when the pupil is smaller than the IOL optic diameter by directly implanting the IOL through the pupil into the capsular bag. To perform this, the surgeon needs an implantation system that allows deep penetration into the anterior chamber, which requires that the IOL cartridge be small enough to enable implanting the IOL behind the iris into the capsular bag. By employing these techniques, a surgeon will be able to perform phacoemulsification in small pupils without the need for iris hooks or dilating rings in almost all cases. Epinephrine is given intracamerally. Followed by viscodilation. Changing to the red light enhancer alone improves the red reflex. Note how the red reflex improves when switching from regular lighting to the red reflex enhancer alone. Blind Kapsulorhexis. The margin of the Kapsulorhexis disappears behind the iris, while the surgeon keeps the direction of his movement. This takes a little bit of practice, however, it works very well. Phakoemulsification is completed through a small pupil with floppy iris. With the aspiration system having its opening upwards, it is quite easy to remove the cortex under the iris. Direct IOL implantation through the pupil. The IOL is coming out behind the pupil. It means no manipulation of the iris. Thank you for your consideration.